Hello doctors, I'm Dr. Mohammad Ahmadullah, or you can call me Dr. Scalpel Artist. So now I'm going to explain you about the anatomy of the needle. So look at here. Here we are having one needle understood the point? Now look at here. So when you talk about this needle, I hope you can see the tapered or the sharp portion. This is called as the tip of the needle, or you can say the point of the needle. Now let us go just to the opposite to that. Now I hope you can see here the one thread is there along with me, right? So this thread is inserted within this body of the what is called the needle, right? So this type of is called as the sways of the needle. So if you are having sways of the needle, what is happening? This is called as the sways needle. Now let me show you another needle. Look at this needle here. In this needle you can see one eye is there, right? So this is through which we are passing the thread and then we are using it. So this is called as eyed needle, and here you are having, look at in this one, here you are having the swage needle. So in the swage needle you can't see any eye, but in the eyed needle obviously you are having the eye. So in the swage needle what is there? By manufacturing itself, the thread has been embedded within it and it has been clipped. Understood? This much clear? So now what about the portion in between the tip or the point and the eye or the swage? So this portion in between that, this is called as the body of the needle. Understood the point? Now let us look here. So we are having one length from the tip till the eye. So that is called as the needle length. This much clear? This is whole portion is called as the needle length from here till coming this way, this one. So in other words you can say the length between the tip of the needle or the point of the needle till the eye of the needle or the swage of the needle along the body of the needle is called as the needle length. So the distance from the tip or the point of the needle to the eye or the swage of the needle, but not along the body of the needle. So that is called as chord length. So this is the chord length. Now look here. Can you see this one? Look at I'm showing here this one, this portion. From this portion to this portion, the straight one. This is called as the chord length. This is not the longest length, okay? This is the small length, but not the smallest length also. Remember this one. This was understood? Now, suppose, look at here. Let me draw and explain you, okay? Suppose this is the needle we are having, okay? So let this be tip, okay? Let this be eye. Am I right? So the distance from here till this one, this is the needle length, okay? This is the longest length. Now the distance from this portion, that is the eye, till the tip, understood, but not along the body of needle. This is called as chord length, okay? And this is not the longest nor shortest length, okay? This was understood? So now look here. So let me draw here once again. This was our chord length. So now look here. From the middle of the chord length, understood the point, till the middle of the body, this is called as radius of needle. So this is the shortest length, okay? This is also called as chord depth. So this radius of the needle is also called as the chord depth. So what about the diameter of the needle? Now let me draw here once again. So this is, suppose you are having what is called the needle, right? This is suppose the needle body. Okay, now let me do the cross section here. So suppose if this is your needle, so this distance from here till here, okay, or another word I can say in this portion, understood? So this is the diameter. Okay, so this is the diameter of the needle, or another words you can say this is the thickness of the needle. Now look at here, can you see this? I am holding this needle here, so this portion, this much is the thickness of the needle, right? So this is the diameter of the needle. Can you look here from the, one gap is there, so that is the diameter of the needle. And this is the cord needle length, okay, and this is the overall along the body, that is the needle length. And this is called as the depth of the cord, or cord depth, or you can say the radius of the needle. So whenever you are having the circular body needle, cord length and the radius of the needle are always equal, understood? But not in all the cases. This was clear. So now let me ask you one question, or let me explain you one thing. Why is the radius of the needle outside the body? The reason behind is that whenever we take a bite, and what is the bite right now? Whenever we pierce the needle in the tissue, that is called as the biting the needle, biting the tissue. Understood the point? Or taking the bite, we can say. So whenever we take the bite, and whenever we drive the needle, etc. and all. Again, now what is the driving the needle? When we take the bite and push the needle through the tissue, that is called as driving the needle. So what is that? I'll explain again once again after that. So what happens? So for this reason, the radius is necessary outside the body. But whenever we are passing the needle through the tissue, one small gap is been created, or trauma is been created in between the cells, right? So that is why the diameter of the needle is needed along the body of the needle. Thank you. Okay guys, so just now I have explained you what is the diameter of the needle, right? So what did I say? It is within the, it is the thickness of the what is called the body, we can say, right? So what about the radius? The radius was outside the body of the needle. Why is it so? Because it is necessary, because when we are doing the maneuver, suppose let me show you, this is the how we are supposed holding, right? So doing the maneuver in this is when I'm taking the bite and when I'm driving the needle, that time this much space is needed for me to do the maneuver. So that is why needle's radius is considered to be outside the needle rather than the half of the diameter, which we have studied in the mathematics and all. So I hope you understood what is the difference between needle length, what is the difference between cord needle length, what is the what is called the diameter of the needle, what is depth of the needle, what is the cord depth, what is the radius of the needle. Understood? So again, the depth of the radius is similar to that of the cord depth. Okay, they both are one and the same thing. Now again, I hope you understood what is the radius of the needle and why the radius of the needle is outside the body, why the diameter is within the body and all. Okay, and what else? One more thing I would like to ask you is that when we are talking about the depth of the cord, that is the cord depth, and the radius of the needle, they both are similar in if the body of the needle is circular. But if it is J shape, etc. and all, so that time it will be different. Just try to remember that. Okay, thank you.